we first got a laser about 7 years ago, so we've got a lot of experience in using it for various different things, mostly orthopaedic. But when we opened the new practice 5 years ago, we decided that we couldn't open a second practice without another K laser. So we've actually got 2 K lasers, and they're both very busy all of the time.
And different clinics, aren't they?
Different clinics. So over in Risca we've got a first opinion clinic where they do the whole range of first opinion type work, and over here we use our laser mainly on orthopaedic cases.
Okay. And as an orthopaedic surgeon, how is it married with your work? How does it help you with your clinical outcomes?
Yeah. So there are different sorts of cases that we use the K laser for. One area is post-operative rehab. So from the point of view of getting the wound healing accelerated, it's very useful. And for basically restoring function, improving comfort, and generally helping patients through the post-operative period, we find it fantastic. One of the big benefits is that if we build in a course of K laser into the post-surgical protocol, then it means that we get a lot more contact with the pet post-surgery. Client compliance is very high, which means that client compliance with all the other things that are necessary is also very high. So we pick up complications earlier and we tend to get much better outcomes for that reason.
And in regards of accelerated healing and pain management, you use it both on the rehab but also for OA cases, don't you?
Yeah, we were lucky that we were looking to establish an offering for osteoarthritis which was multimodal. And we wanted to make a team approach, so what we were able to do by having the K laser was to build all the other services around the K laser. So K laser is really a nurse-led modality. So what we've done is we've set up nurse clinics for K laser and built around that all the other parts of the multimodal modality offering around that, such as regenerative medicine, such as physiotherapy, such as our analgesic medications. It all fits in nicely, but the kind of the cornerstone, it all hinges on the fact that we've got people coming back twice a week usually to have their K laser, and it gives all the clinical team the opportunity to educate the client on things like weight management, and it just fits very nicely together.
And in regards to wounds and some of the things which unfortunately happen post-operatively, have you seen an improvement with its use?
Yeah, undoubtedly. Obviously all our cases are anecdotal, so but certainly from our point of view, I wouldn't be without it as a method of accelerating healing and improving outcomes.
Okay, that's great. And as a team, has it been taken on well within the clinic?
Well, the great thing about K laser is that it is mainly administered by the nursing team, so that frees up the vets. Okay, so the vets can do the vet things, and then the nurses can take on the caring side, and it really improves the sort of the nurses' status within the team. So our nurses, in the old days, I remember the time when we never even had nurse clinics, but now we couldn't not have nurse clinics because our K laser is being used multiple times per day. So we really have elevated the sort of status of the veterinary nurse within our practice. They're a lot happier, patient outcomes are better, clients are happier. It's a win-win.
And it works well with your vet team?
Absolutely.
Yeah. And from a business point of view, how has that helped your business grow?
Well, there are 2 ways of looking at that. There's the revenue side, and it definitely increases revenue, that's for sure. We've proved that. And it's something close to 200% of the purchase cost over 5 years. So it's a good money maker, but more than that, it increases client satisfaction, it increases our reputation, and it increases footfall. So it kind of cross-pollinates all our other services, because we've got people coming in more regularly for the K laser treatment with their pets, which means that they can be educated and take advantage of what other things that we've got on offer.
And is it true that Jenny is 20 years old?
Jenny is 20 years old, rising 21.
Amazing. Thank you, Dressel.